Okay, I've arrived on scene. My scene appears to be safe. I do have BSIs on. I don't see anybody around my patient to tell me what has happened, but my general impression is that I have one single male patient. It is snowing out, so we're going to be careful not to slip. It appears as though my patient potentially fell down the stairs. Due to the suspicion of trauma, I'm going to have my partner hold inline manual stabilization. Checking for responsiveness now. Hello, sir. I have no response. Check for painful stimuli, response to painful stimuli, pinching the shoulder, no response, pinching the ear, no response. Now I'm going to move into my ABCs, checking my patient's airway using a modified jaw thrust. And it appears as though I have some gurgling respirations, so I'm going to suction my patient for no longer than 15 seconds. Once I've done that and my airway is clear, I'm going to insert an oral airway to maintain that patient's airway. Checking for respirations now, or breathing now rather. And I do have shallow respirations. To assist my patient with his respirations, I'm going to have my partner administer high flow O2 at a rate of 15 liters per minute via a bag mask device at a rate of 12 to 20 breaths per minute. Going now into circulation, I'm going to check my patient's carotid pulse and the radial pulse. And I do have weak and thready pulses. Now I'm going to check my patient's skin temperature, color, and condition. He appears to be cool and diaphoretic. At this point, I'm going to go into my chunk check now, checking for any obvious bleeding or injuries. I don't see anything obvious jumping out at me on top of my patient, so I'm checking behind the back now. And I have located a leg injury, possibly due to the fall. And at this point, due to my patient's condition, I'm going to declare him a candidate for rapid transport.